Okay guys, so this is the general sequence for the lower leg and the hips. So with this, you can start out by placing your palm sort of on the tibia, and then you could do a nice little like stretch in along the shins. This can be a little bit extreme for some people. And what you're doing is you're kind of rolling the leg as you're working through, so you're creating a little bit of movement as you're working through. So just creating a nice stretch. This is good for anyone who's a runner, who has any restrictions in their ankle. And you want to make sure you get this kind of meatier part towards the top of the knee. You can also move up and work up the quads like that as well. Just creating a nice little compression, a little bit of traction in the muscle tissue there. And then from there, you can bring them into a figure 4 with their foot on the inner thigh. And then you can get on the table and you can still kind of work on the foot from this position. So you can take your fingertips and just do a nice little spreading technique in the foot. You can kind of work up the inner portion of the calves as well. So just doing some spreading, just fingertip spreading, I find is easiest. And this is really nice for opening up along the soleus and the gastrocs. You can kind of follow that all the way up. You can even work in through the adductor muscles, just doing nice little spreading techniques. And that's a nice way to work in through these muscles, which is good for anyone who has like pelvic floor issues. Sometimes there's a lot of tension in the adductor muscles. You kind of work your way up. And then from here, what I'm going to do is I'm going to get on the table and then I'm going to take her leg. I'm going to bring it out like this. Just going to keep her leg like this. And then I'm going to place my feet on her leg. So with this first technique, you can actually just place one foot down. And then what I'm going to do is I'm going to take her leg like this. And then I'm going to bring her into plantar flexion and just create a little bit of traction for the knee. And you could hold that for 5 to 10 seconds, bring them out of it, bring them back into it, as we've discussed many times. And you can do that 3 times. And as you guys can see, this is pretty easy on me. Then you can bring them back, place your feet down, and just do some nice little massage in the hamstring with your feet. That feels really nice. It's good to incorporate your hands and feet. It helps to save your hands over time. And that's one of the cool things about Thai massage, is using your feet for a lot of different techniques. And then from there, what you can do is bring their leg around, and then you can take their quad and do a nice little stretch. So it always reminds me of kind of like a wrestling move or like a Muay Thai kind of thing, where you're creating a bit of traction. You're stretching in through the anterior hip down this line. And you could even take your forearm and kind of bend the leg a little bit more and then just create a nice little traction. That feels really nice. Then you can take their leg, bring it up like this, bring them back to neutral. You can get up, got some cat hair there, and then you can take your foot and just do a little bit of massage in the hamstring. You can even traction the knee a bit from this position if you want. You can bring the foot like this and just do some nice kneading with your feet as well, down the hamstrings, just some nice compressions. I like to use my whole foot just because it's easier and you get a nice broad contact. And then from here, what you can do is take the leg long, bring the leg out, and do a nice little adductor stretch so you can stabilize one leg, or you can even stabilize the hips so they're not rolling forward so much. And then this is a nice stretch for the adductor muscles. And I'm just using my knee to kind of bring her into the stretch a little bit more. And you could bring them back again. You could do this 3 times. 1, 2, 3. Then you can bring the client back to neutral, leg long, do a nice hamstring stretch with you on the table supporting their ankle, and then you can kind of use your body weight to bring them into the stretch. Once again, you can come back, bring them back into the stretch. If they find they struggle with it, they can even bend their knee slightly, and that's okay as well. And then from here, you can kind of bring their leg down. And then you could also do some forearm rolls to kind of stretch the hamstring fascia. So when you roll like that, you're going to feel a stretch in the tissue because this is an oil-less massage. You're gaining a lot of traction with the tissue. And you can kind of work that down into the glutes. And I'll do that like 3 times. And that's enough to get a really good stretch in the hamstring tissue using the forearm rolls. Then you can bring their leg like this over their other leg into a figure 4. And then you can create a little bit of stretch by placing one hand on their foot and then one hand on their knee just to help stretch in through the inner thigh. Bring them back 3 times. 3. Then you can cross their leg over this knee. You can take this long leg, bring them up, and you can do sort of like a modified pigeon from this position. And you could bring them into that stretch. You could even work down in through the glutes from this position as well. And just doing some kind of pressing and twists, which feels good for working the soft tissue around the glutes as they're doing the stretch. And you want to make sure as you're doing this that you work in through the hamstrings as well, not providing too much pressure down. You're just kind of squeezing the tissue and twisting, squeeze and twist, squeeze and twist. Then you can bring them back down, bring this leg long. You could, for dramatic effect, drop the legs like that and move on to the next leg. Okay, so we finished this leg. Now I'm just going to review with you guys on the other leg and also just to make sure that Ashley leaves here being balanced. Okay, so you can start on the leg by once again doing some rolls and then just taking your palm and just doing some stretches as you roll the leg back and forth. Just creating a little bit of traction in the tissue, a little bit of stretch. You can follow that up the leg by just doing some compressions in the quads as you kind of move and roll the leg. You can also just do some compressions if you really just want to move fast, just to kind of warm up the muscle tissue before you go in and work on it. Now from here, you can take the client's leg, bring them into this figure 4 position with their foot on their inner thigh like that. You can work on their foot from this position if you want to, with some spreading along the plantar surface. And then you could also just work in through the calves. Just do some nice spreading techniques here. Trying not to get on the table to kind of show you guys. But you guys get the drift. We just displayed this. So you're just doing some spreading along the calves here, just squeezing, spreading, anything that just helps to warm up the muscle tissue for the stretches that are about to come. Then you could go on the adductor muscles and just do some spreading with your palms. And just remember that these are really sensitive muscles, so you don't need like a crazy amount of pressure here. You're just providing a nice little gentle stretch and pull. And then from here, what I'm going to do is get on the table, and then I'm going to take her leg like this. I'm going to place one foot towards the knee joint, and then I'm going to take her other foot, and then I'm going to place my leg long. I have pretty long legs. And then I'm just going to kind of traction her knee joint by pulling her foot into plantar flexion. So I'm pulling our foot into plantar flexion, providing a nice little traction. You can go back and forth, just providing a bit of flow and movement as you do this technique. Then you can place both feet on the hamstrings and just work on the hamstrings with your feet. And that can feel really nice and just an easy way to take a break on your hands as you're working through the treatment. So just back and forth like a cat would need. Then from here, what you can do is bring their leg around with your feet like this, and you're creating almost like this little Muay Thai hold where your leg is providing a little bit of support for the ankle. And then you can just kind of move them into a traction of the hip and the quad. So with this, you're kind of pulling down this line of the body. Just doing some nice spreading techniques along the quad. And that's really nice for just stretching the leg, and it also helps to stretch the tib-fib joint and the ankle as well. Then from there, you can bring them back up. And with this, you can kind of stay on the table, and you can just provide with the balls of your feet, you can do a little bit of massage in the hamstrings, back and forth. Then from there, you can bring the leg on the table. And actually, I forgot to show this on the other leg, but you can sit on their foot, and then you can kind of just at each segment of the quad, just provide a nice little traction and moving up and down. You can even take your forearms and kind of just roll along the quads here. Just doing this nice kind of roll technique, just like we did to the hamstrings to help stretch the fascia and tissue of the quads. Then after you've done that, what you can do is take the leg long, bring them into an adductor stretch. You can anchor down at their other hip, kind of hold it in place, and then bring them into the stretch, bring them back, bring them into the stretch, hold it for 5 to 10 seconds, bring them back, bring them into the stretch, hold for 5 to 10 seconds. Then you can bring them back, leg long, into a straight leg raise. You get on the table, place your shoulder on their ankle, and bring them into a hamstring stretch. Once again, creating a bit of movement back and forth. And they can bend their knee if they want, if they're very tight in their hamstrings. And then from here, you can get them to bend their knee. You can place your forearm down and just roll and stretch out the tissue in the hamstrings. You can do this forearm roll technique. You can even just do a bit of compression with your hand on the other side and just do some nice circular kneading in the hamstring as well. So it's all about getting creative with it, and there's so many different ways to do this type of treatment, especially when you're doing all of these different motions. And then from here, after you've done working on the hamstring, you can bring the foot over like this and do a little figure 4. And then to place a little more stretch for the interior thigh, you can place your hand down on the knee, and that provides a little bit more stretch here. And once again, you could do that 3 times. And then transition that into bringing this leg long into a modified pigeon. And like I said, guys, your shoulder would be supporting them here. And basically, or You can also just use your hand to kind of bring them up like this. And then you could use your fist to kind of work in through the hamstring, just providing a little bit of compression and twist. And you can work in through the glutes from that position as well, which is really nice for helping someone move into the stretch and kind of distract them as well. So once you're working in the glutes from this position, you can bring the client back down, legs long. And then I'm going to show you guys how you can finish off the sequence with the legs. Okay, so to finish off the leg sequence, this is optional, but this is a nice thing you can do as well. You can bring both of the legs up, and then you can kind of support with your hands and then kind of bring them into a back body stretch in through the posterior chain and bringing their legs straight towards them. Some people, it's going to be a little bit hard to do this, but this is just a nice stretch for the lower back and the posterior chain. And you can do it 3 times and hold it for 5 to 10 seconds. Bring them back. You can get on the table, transition them into happy baby, so you can just let them know to relax their knees. And then you can provide like a slight overpressure by bringing their knees towards their body. And that provides just a little extra stretch in through the pelvic floor. And then from there, you can bring them back down and we can go on to work on the rest of the body.